right, so for chapter 2, chapter 2 is principles of pharmacology, but really what chapter 2 is about is pharmacokinetics. So, pharmacokinetics. Pharma means drugs. Kinetic, or kinesis, moves. Right, movement, right? So it's about the drug's movement. Okay? So how is the drug moving through the body? So a really, really simplified definition of pharmacokinetics is the body's effect on the drug, or the drug's movement through the body. And let's talk about food for just a second. All right? So you have some, I made asparagus last night. All right, so there's some asparagus on your plate. What do we have to do to make that asparagus do something good for your body? We have to take it in, right? We have to ingest it. Well, in the case of medication, that's called administration. So we have to get it in our body first before we can get any benefit from it. All right? Now let's think about that asparagus or that Snickers bar or whatever you want to put in perspective there. What's going on? What happens? You put it in your mouth and you do what? You chew it up, right? So what's that do to that piece of food? Breaks it down. Okay? So medicine goes through the same process. If you take a tablet, it has to be broken down. In pharmaceutical terms, that's called dissolution. When we break something down. It's like dissolving it out. Okay? Alright, so I chewed it up, now what am I doing? I'm going to swallow it, and then where's it go? So it goes down in my tummy, right? Which our tummies are actually like up here. So what's happening in the tummy?
Things are being stored.
Okay, so we have digestion going on, things are being broken down, maybe some absorption, but generally it's just kind of a holding pouch where it's churning stuff up and breaking things down. So for medicine, it's kind of the same thing. All right, then it empties our stomach and goes where? Not the large, it goes to small intestines. So it leaves the stomach and it goes into our duodenum, which in my head I always say duodenum when I have to spell it. Even though I know it's pronounced duodenum, I always say duodenum so I spell it right. So in the duodenum, that's where all that chyme, that digestive stuff gets deposited. Okay, what's in our stomach? Acid. Our stomach has a special lining that protects itself from acid, but the rest of our body doesn't have that. So we have to neutralize as it comes out. So as it goes into our duodenum, it gets sprayed down with certain chemicals like sodium bicarbonate and things like that to neutralize. Well, we're not so worried about medicine that way. But your stomach is an acidic environment and your intestines are an alkaline environment, a non-acidic environment. What happens in your intestines? The absorption, the food, we get the nutrients, right? We get those vitamins and those minerals and those fats and all that other stuff. It gets absorbed into our body. Well, guess what? That's where drugs get absorbed too. Now, if you took too much sugar or too much fat, where's it going to go? To your hips and your thighs and your, right? In places you don't want it to go. Well, medicine follows a different route. That's where we start to lose some of that similarity. But at least kind of maybe I've given you a picture of the processes that goes on. Even with food, when all is said and done, we have elimination, right? The leftover products get put out of our body. So with drugs, the same thing. So there's 4 processes in pharmacokinetics: absorption, distribution, metabolism, and elimination, or what we also call excretion. But before any of this can happen, you have to take medicine. Okay, I have a headache. I take a Tylenol. I can't place the Tylenol on my forehead and expect my headache to go away. Right? It has to go into my body. And does my headache go away as soon as I swallow it? Because it's got to go through these processes before it can get to that place in my body that turns the headache off. Now, some things are going to work more rapidly and some things are going to work more slowly. But they will all go through a process. So the pharmacokinetic phases, there's 4 phases. Absorption is the movement of the drug into the circulatory system. Now, the absorption can vary depending on whether it's an orally administered medication or an injection, a parenterally administered. Distribution is the movement of the drug from the circulatory system to the site of action. Okay, what's the term site of action mean to you? Where the drug does its job. Okay? Metabolism is a biochemical change to the drug. So it gets chemically altered. Maybe it changes a water-soluble drug into a fat-soluble or vice versa, or turns it into a metabolite that would actually work. And then we have elimination, which is taking it out of the body. So absorption, the process involves movement into the blood, circulatory, or possibly lymphatic system. It's generally the first phase, but it's not always the first phase. If a drug is given by an intravenous injection, we don't have absorption because it's being put straight into the distribution. If it's going through our skin, it's got to absorb. If it's going through our muscle, it's got to absorb. If it's going through our stomach, it's got to absorb. If it's going through a mucous membrane, it's got to absorb. Sometimes it's more direct absorption, like sublingual. Go home and look in the mirror and lift your tongue up and see all of those blood vessels underneath your tongue. It's a very thin layer of cells versus your skin, right? Your skin's much thicker. So if it's an injection, an intramuscular is going to absorb more quickly than a tablet that's going through your stomach. So it's all relative to what is the dose form and the route. But if it's IV, there's no absorption. The rate of absorption, talked about that. Is it a solid? Is it liquid? Is it gas? Of course, gases are going to absorb quickest because they pass through with the least resistance. Liquids will generally absorb more quickly than a solid because they're already broken down. And solids have to be dissolved before they can be absorbed. So they're generally the longest. This picture is just showing, again, so if it's given as an IV, I don't know how to make my little red light show. Goes directly into the circulation and goes around to your site of action before it's metabolized generally. Where when you take it orally, it usually will go metabolism before it goes distribution. So it can change the way things go. So your small intestine is right next to your liver. So most of it will go straight to the liver, be metabolized, and then back out into your circulatory system. And this little graph just shows, okay, I gave it as an injection, all my medicine's available all at once. And then it goes away over time. Where if I take it orally, as it's breaking down and being absorbed, my levels are slowly going up, and it reaches a peak and then comes back down. And we have to know that with some other route of administration, whether it's oral or transdermal or intramuscular, as the drug is being absorbed, some of it's already starting to be broken down. So that peak is never going to be as high as when we do all of it through the vein. That's why the yellow has a higher set point in the concentration level. It might be the exact same amount of medication that was administered to the patient, or it could even be that the injection was less than the oral or other route of administration. But because it's also being broken down as it's being absorbed, it's never going to have that same level.
Does that play in with like the time release? Mm-hmm. Directions say 3 times a day versus every 8 hours?
Yes. Okay, so great question. The question is about dose frequency. And how some medications say take 3 times a day and some say take every 8 hours. Every 8 hours is important to maintaining a therapeutic maintenance level. And that way there's like no dip in the medication. And there's a lot of different, it depends on the medication, what the purpose is. Somebody who has seizures, to maintain the appropriate level, they have to take their medication at the same time all the time. Even birth control, people don't think about this. They're like, oh, I took it today, whatever. No, some people's bodies, their chemical levels are so delicately balanced that if it's not taken at the same time every day, an hour later, those hormones could dip or go up and in 9 months have a surprise. So again, it goes back to people in their own bodies and how things work, but some medications have to be dosed on a set schedule, where others, certain anti-infectives, things with long half-lives, really long half-lives, as long as you take it 3 times today and you get enough in your body, you're good. Generally, things with a shorter half-life or a more specifically defined half-life are going to be more specific in the dosing. Did that make sense?
Yeah.
Okay.
So if it says like take 3 times daily, it doesn't matter what time?
Most of the time, no.
You take it like wake up, lunchtime before you go to
bed. Yeah, and sometimes, and even some medications, like for patients who have diabetes, maybe they take a medication 3 times a day, but it's supposed to be with breakfast, lunch, and dinner. Not every 8 hours, it's when there's food present. Where somebody who has a very serious infection and we need to control the growth of that bacteria or that virus, they have to take it at the same time to make sure that those levels don't drop. So it's what keeps us so interesting. There's just so much going on. And there's, like I said, there's no absolutes when it comes to pharmacy and pharmacology. To me, that keeps it interesting. Now, absorption, there's some things that we have to keep in mind when we talk about absorption. The cell membrane, it has to move from one area to another, so it's got to cross membranes in our body. So it's going from the intestine into the bloodstream. So we know we have capillaries and thin membranes and things. So a couple of things. First of all, what makes up a cell membrane? Lipids and proteins. So proteins and fats, proteins and lipids. Those are important components. Now, for things to absorb across those membranes, water won't absorb. Oils and fats, think about it. So if the membrane is made up of lipids or fats, like absorbs like.
Fat soluble.
So we want something that's fat soluble to absorb well. So if you take a medication orally that is more water soluble, it can take longer for it to absorb. Or it may need some help, like active, think of the word. Thank you, active transport, like diffusion. Now, there's different ways that it'll work. But if it's more fat soluble, it generally absorbs a little bit quicker. So, talking about those transport systems, passive transport doesn't require any energy. And it's concentration gradient based. So, it's dependent upon the concentration. Think about salt. Okay? Think about your body and salt. You're watching a football game and you're eating chips. What happens? You get thirsty, right? Because your body's saying, I got too much salt over here, it's not diluted enough, we need some water in here to keep that salt balance. So things move in your body that way too. We want to keep everything in equilibrium. What's it called when your body's in equilibrium? Homeostasis. We want to maintain that homeostasis. So if we have too much drug over here and there's no drug over here, we want to balance that out. So passive diffusion helps with that. Now osmosis, which is water-based, is a type of passive diffusion. Why does it keep hitting 2 times? Or am I hitting backwards? Active transport. Drugs move across membranes without regard to the concentration. So if I've already got a full section, and I'm trying to push more into the full section, it's going to take some energy. So active transport requires energy. Now sometimes facilitated, it's minimal energy, but it still needs energy. So a facilitated transport would be, all right, so you need to get over there, but I'm going to help you get there. Does it take a lot of energy for me to push him over? It takes some energy, but it doesn't take a lot. He's on wheels. I'm good. Where if I had to pick you up and carry you myself, that would take more energy. Right? If I had to move you over there and then it was already full, I had to push it, that's going to be more energy. So those are the different things with the active transport. So we have proteins sometimes that'll help carry it in. Sometimes we'll have a channel that's open, kind of like a canal, that might let something that's water soluble in that you would think wouldn't be able to get through. So there's a few other ways for things to get through into the cells. All right, this is a great place to stop, just on time. Keep reading chapter 2, read into chapter 3. And we will continue on Monday.